Today, healthcare leaders operate in the most dynamic market in the world. Innovation, technology, regulatory reform, and growing demand for services make this an attractive marketplace for capital investment and creative solutions. Despite these opportunities, significant challenges pose roadblocks to success, including regulatory risk, declining reimbursement, and malpractice liability. Rapid migration from manual workflows to a digital environment is essential to achieving operational improvements. This transition is particularly painful for the engine of any healthcare system, the physician practice. Practices commonly experience debilitating productivity drops during the process. In one study, this disruption cost a health system $38,000 per month for a primary care physician, with some specialties experiencing upwards of $58,000 in lost monthly revenue. When one considers the average cost to replace a physician is $250,000, the importance of maintaining physician satisfaction rises to a critical level. So how do you minimize the disruption and keep physicians satisfied? Emerging innovations in data transition are catalyzing these projects with impressive results. One practice, Front Range Primary Care of Colorado, has found creative solutions to the challenges of implementing digital workflows. Dr. Eric Cahey is one of the providers at Front Range and has witnessed successful and failed EHR implementations during his career.
So when you were transitioning from paper charts to electronic records, what are the biggest challenges?
Transitioning from paper charts to an electronic medical record system is difficult for the front office staff, doctors, nurses, everyone involved. They're trying to learn the new EMR system and at the same time take our paper charts and put them into the EMR so that we can use that information. ImagIN helped us with the transition. We sent them our paper charts, they scanned them, put them into our EMR so that we could make better use of the information there. It's now a single source of information so that we can take care of more patients quickly and efficiently.
Whenever my staff and I have to reference both paper and electronic records, we waste a lot of time moving between the two sources, looking for critical information.
Minimizing the transition period is essential to controlling productivity losses that can vary from 25 to 40%. Reducing the transition period by 30 days can save millions of dollars. Additionally, electronic records produce returns in both compliance and meaningful use activities. Over half of all RAC audits result in some level of penalties, with over $1 billion in takebacks occurring during a 3-year period. Enforcement of HIPAA high-tech is ramping up, with hospital systems paying as much as $100 million in fines. During the implementations of EHR systems, delays lead to escalating costs. One case study of a single provider reported over $300,000 in lost system revenue. Slow deployment also contributes to physician dissatisfaction in an era where the total cost to replace a physician is $250,000. These factors underscore the essential nature of fast-tracking the EHR transition. ImagIN offers no-risk assessments of your digital migration. For more details on how you can dramatically reduce your compliance risk and catalyze your EHR transition, contact your sales representative or ImagIN Consulting at 303-407-0524.